Reducing Child Mortality by Mia Hawk. Millennium Development Goals, also known as MDGs, are 8 goals that are aimed towards improving the quality of the lives of the world's poorest people. The MDG goals were created to help fight against poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. In order to meet these goals, leaders from 189 countries met to sign the Millennium Declaration in the year 2000, which agreed that the goals would be met in 2015. The world has made major progress in achieving many of the MDG goals. Many achievements have been made along the way, such as between 1990 and 2002, average overall incomes increased by approximately 21%. The number of people in extreme poverty declined by an estimated 130 million. Child mortality rates fell from 103 deaths per 1,000 live births a year to 88. Life expectancy rose from 63 years to nearly 65 years. An additional 8% of the developing world's people received access to water, and an additional 15% acquired access to improved sanitation services. As you can see, with the MDGs being created, we as a nation are making major strides to better help our nation and create safer, healthier environments. 2 of the MDGs are related to health, which proves just how important it is for an individual to live a healthy lifestyle and have proper access to sanitary surroundings. The MDGs are very beneficial to our communities because they are helping our leaders to end poverty, hunger, and diseases, which are major causes that are killing individuals each day. These goals are important because achieving the goals will mean 350 million fewer people are without safe drinking water and 650 million fewer people live without the benefits of basic sanitation, allowing them to lead healthier and more dignified lives. Hundreds of millions more women and girls will go to school, access economic and political opportunity, and have greater security and safety. The MDG that I have chosen to write about is reducing child mortality. The reason I am choosing this topic is because I feel it is a very important topic that often goes unnoticed. Reducing child mortality is very important because our kids are our future. Children have a special place in the global health agenda because they are so vulnerable. Their vulnerability raises important ethical issues about the responsibility of adults to ensure the health and survival of children. It is unfortunate that almost 6 million kids under the age of 5 have died in 2015. The reason these kids are not making it past the age of 5 is due to the fact that their mothers are uneducated. They do not have adequate access to sanitary conditions or health care, or due to low income. These conditions are all able to be prevented and could be treated with access to affordable interventions. An organization that works towards advocating and providing low-cost intervention is the U.S. Fund for United Nations Children's Emergency Fund, which supports UNICEF's work and other efforts in support of the world's children through fundraising, advocacy, and education in the United States. UNICEF does whatever it takes to save and protect the world's most vulnerable children. 40 years ago, UNICEF figured out that promoting simple, low-cost interventions like hand washing and breastfeeding could save millions of lives. In reference to the implications that the Millennium Development Goals for global health outcomes are set, is to ensure the successful continuation of the reduction of child mortality. By implementing the MDGs into our nation, we are raising awareness and ending the negative effects of that poverty, uneducated mothers, and poor sanitation and hygienic conditions bring to our communities. An important implication that the MDGs are bringing to the table is focusing on creating availability for low-income families to have access to education. If these individuals are able to become educated on the negative effects that poor hygiene, contaminated water, and not properly immunizing your kids have on them, they would be less likely to expose them to those conditions. On another note, if they have access to those types of conditions, it is the leader of that community's main priority to create access to a sanitary environment. Child mortality is most prominent in low and middle income countries. About half of the deaths that took place in 2013, which added up to be 6.3 million, took place in countries such as India, Nigeria, the Democratic Republic of Congo, Pakistan, and China. Most of the deaths that occurred in high-income countries were due to neonatal mortality. Our Global Health book states, The lower the income group of the region, the more likely under 5 children are to die of infectious causes. The higher the income group of the region, the more likely under 5 children are to die of conditions related to birth, such as congenital anomalies. As you can see, in a higher income group, we are less likely to have children die from infectious diseases because we have access to quality health care, whereas those in the lower income group do not. Child health is extremely important in the early stages of life. Making sure your child is born healthy, vaccinated on schedule, and raised in a safe and hygienic environment is vital. As it is already known, the rates of child mortality varies with income, education, and location. UNICEF did a study several years ago that showed in sub-Saharan Africa, children from the lowest income quintile had almost twice the risk of dying before they were 5 years of age as children in the highest income quintile. We, as a wealthy country, are lucky to have access to quality health care. People do not realize how fortunate we are to have the things we have, such as safe drinking water, sanitary conditions, access to health care, and the availability of education. The goal of the MDG, reducing child mortality, is to reduce the number of deaths among children and to educate mothers. By the leaders of these affected countries promoting and educating individuals on the importance of sanitary and hygienic conditions, this can help to reduce mortality. Since the Millennium Declaration was signed, goals are being met because the mortality rate of children is digressing. Substantial progress has been made globally in reducing the number of mortality rates in children each year. The number of under 5 deaths worldwide has declined from 12.7 million in 1990 to 5.9 million in 2015. 16,000 every day compared with 35,000 in 1990. Since 1990, the global under 5 mortality rate has dropped 53% from 91 deaths per 1,000 live births in 1990 to 43 in 2015. Today, we are aiming to reach the goals that were set. WHO states that between 1990 and 2015, 62 of the 195 countries with available estimates met the Millennium Development Goal for a target of the 2/3 reduction in the under 5 mortality rate. In the last 60 years, the UNICEF has been in business. They have seen a 50% reduction in under 5 mortality between 1960 and 2002. They have found that vitamin A supplementation can save over 250,000 lives a year. Oral rehydration therapy can prevent 1 million deaths, and immunization programs can protect the lives of nearly 4 million children. Child deaths have been almost halved over the last few years, and that is possible because of better nutrition, healthcare, and quality of living. It is said that in 1990, more than 12 million children in emerging countries died before the age of 5 from diseases such as diarrhea, malnutrition, pneumonia, AIDS, malaria, and tuberculosis. Thankfully, by 2012, that number had dropped to 6.6 million. However, under 5 mortality rates remain unacceptably high, especially considering that most of these deaths are due to preventable or treatable causes. The child mortality MDG is one of the goals lagging farthest behind. More than half of all countries are not on track to reduce the under 5 death rate by 2/3 by 2015, and less than 1/3 of IDA countries will meet the goal. In my opinion, they need to make public figures and nonprofit organizations that facilitate the well-being of humanity more involved and aware of this ongoing problem, so they may reach their goals in a timelier manner. An example of where the MDG reducing child mortality has been incorporated is in Afghanistan. Afghanistan has the second highest rate of under 5 mortality in the world, but progress is being made to reduce child mortality. The World Bank states under 5 mortality dropped from 257 per 1,000 live births in 2002 to 97 per 1,000 in 2012. Full immunization coverage in rural areas tripled from 11% in 2003 to 30% in 2010/11. These statistics show how each year Afghanistan is making strides to better their country. In summary, with everyone working together for the common good, there is no reason we cannot achieve successful results to reduce child mortality. Even though some countries did not meet their goal of reducing the rates of child mortality by the year 2015, that doesn't mean we should stop working towards that goal. Whether it is this year, next year, or 3 years from now, we are working toward an incredible goal, and the end result will forever be satisfying if we can help to diminish this ongoing rate of child mortality. Here's a few pictures that I chose to put on my slideshow. The first one is Target 4. Target 4 was to reduce child mortality rate by 2/3 between 1990 and 2015. Globally, a huge amount of progress has been made in reducing child mortality under 5 years of age. In 2011, only 6.9 million children under 5 died, but in 1990, 12 million died. Between 1990 and 2011, under 5 mortality declined by 41% from 87 to 51 per 1,000. The rate of decline has accelerated in recent years, per 1.8% per year during 1990 to 2000 to 3.2% during 2000 to 2011. Even though this improvement, the world is unlikely to achieve the MDG target of a 2/3 reduction in 1990 mortality levels by the year 2015. In 2011, measles immunization coverage was 84% among children aged 12 to 23 months. More countries are now achieving high levels of immunization in 2011. 64% of member states reach at least 90% coverage. Between 2000 and 2010, measles deaths decreased by 74%. This meant 1/5 of the overall decline in child mortality. The picture beneath says children from the poorest households are 1.9 times as likely to die before the age of 5 as children from the richest households. Next to that is a chart that says causes of deaths among children under age 5 in 2008, and mostly the cause of death was from neonatal issues. In the center of the chart, it says globally more than 1/3 of child deaths are attributable to undernutrition. And as you can see, there's malaria at 8, AIDS at 2, injuries at 3, measles at 1, pneumonia at 14, diarrheal diseases at 14, other causes at 16, and neonatals at 41, making it the highest of them all. And above that is just a poor little boy with a cut in his face drinking from unsanitized water. And here's my references, and that's it.